So this is one of the great moments during the year for EBMT, the EBMT annual meeting. Unfortunately, for the second year in a row, this will be fully virtual because of the COVID-19 pandemic. Nevertheless, we believe the organizing committee and the EBMT governance has put together an exciting program as usual. And we will cover novelties in the field of hematopoietic cell transplantation. As for myself, I very often speak on CAR T cells, but we have to remind that our origin, our core expertise is in the field of hematopoietic cell transplantation. This is still very much useful to a number of patients with a variety of malignant and non-malignant diseases. So you should expect updated information on the many modalities of hematopoietic cell transplantation, autologous and allogeneic cell transplantation, how it is part of increasingly complex strategies driven by biomarkers and imaging, followed by post-transplant immune intervention or the use of post-transplant targeted therapies, how we can offer access to allogeneic transplants to older patients because the procedure becomes safer, and how we can offer transplants to a growing proportion of patients because we now do routinely use haplotype mismatched related donors. And we will cover these different topics for different categories of professionals. As usual, we have several special tracks, such as sessions dedicated to the nursing group and nurses population. We have the cell therapy day. We have put together very exciting program in the cell therapy day. So that's one aspect. Obviously, the other aspect we will cover are CAR T cells and other types of immune effector cells that now are becoming used for different categories of diseases. And finally, we cannot think of a 2021 annual meeting that would not cover the consequences of COVID-19 on our core activities. How does the COVID-19 epidemic disrupt, and to which extent it disrupts the supply chains for various types of hematopoietic cell transplant and cellular therapies, and how do we manage transplant patients or patients receiving CAR T cells in the era of SARS-CoV-2 infection worldwide.